Diuretics are the first type of drugs used for managing hypertension. Three basic types of diuretics are used to decrease blood volume and lower blood pressure. Frequent voiding caused by any type of diuretic may interfere with daily activities. Teach patients to take their diuretic in the morning rather than at night to prevent nocturia. Teach men that they may experience decreased libido and decreased sexual performance when taking thiazides. Thiazides should be used with caution in patients with diabetes mellitus because they can interfere with serum glucose levels. Caution is also indicated for patients with gout or a history of significant hyponatremia because these problems can worsen with when thiazides are taken. Calcium channels are found in the myocardium and vascular smooth muscle cells. Calcium increases muscle contractility, peripheral resistance, and blood pressure. Calcium channel blockers are also called calcium antagonists and calcium blockers. They block the calcium channel, promoting vasodilation. Angiotensin converting enzyme inhibitors inhibit ACE, which in turn inhibits the formation of angiotensin II and blocks the release of aldosterone. Remember, aldosterone promotes sodium retention and potassium excretion. When aldosterone is blocked, then sodium is excreted along with water and potassium is retained. ACE inhibitors cause little change in cardiac output or heart rate, and they lower peripheral resistance. One other thing about the nagging cough that's a side effect of ACE inhibitors. It can be annoying. It's not really pathological in any way, but oftentimes if the patient is annoyed by it, they will often be changed to another group of antihypertensives. Angiotensin II receptor blockers are similar to ACE inhibitors in that they prevent the release of aldosterone. They act on the renin-angiotensin-aldosterone system. The difference between ARBs and ACE inhibitors is that ARBs block angiotensin II from attaching to the receptor site, whereas ACE inhibitors inhibit angiotensin converting enzyme from even making angiotensin II. ARBs cause vasodilation and decrease peripheral resistance. They do not cause the constant irritating cough ACE inhibitors can. Beta blockers reduce cardiac output by diminishing the sympathetic nervous system response to decreased sympathetic tone. With continued use, vascular resistance is diminished and BP is lowered. Beta blockers reduce heart rate, contractility, and renin release. Anti-anginal drugs are used to treat angina pectoris. This is a condition of acute cardiac pain caused by inadequate blood flow to the myocardium due to either plaque occlusions within or spasms of the coronary arteries. With decreased blood flow, there is decreased oxygen to the myocardium, which results in pain. Anginal pain is usually described by the patient as tightness, pressure in the center of the chest, and pain radiating down the left arm. Nitrates affect coronary arteries and blood vessels in the venous circulation. Nitrates generally cause generalized vascular and coronary vasodilation, thus increasing blood flow through the coronary arteries to the myocardial cells. The statins were first introduced in 1987. By inhibiting cholesterol synthesis in the liver, this group of antilipidemics decreased the concentration of cholesterol, decreased LDL, and slightly increased HDL. Cholesterol absorption inhibitors may be used alone or with statins to inhibit the absorption of cholesterol. Fibrates are yet another type of antilipidemic drug, and they essentially just inhibit triglycerides as opposed to cholesterol synthesis. Actually, for all types of antilipidemics, emphasize the importance with the patient of follow-up exams with their healthcare provider to determine the effectiveness and to monitor for any ill effects of the drugs. They have a tendency to cause some side effects such as vertigo and nausea and even vomiting. For treatment of confirmed diagnosis of DVT or pulmonary emboli, a patient will be started on IV heparin because the onset of action is 20 to 60 minutes. The peak action is reached in 2 hours and the duration is 8 to 12 hours. Even before the infusion is begun, an IV bolus of heparin will be administered, which onset is immediate with peak action in 5 to 10 minutes and a duration of 2 to 6 hours. Also, you may see the healthcare provider order an oral anticoagulant simultaneously. Warfarin works in the liver to inhibit synthesis of vitamin K, dependent clotting factors, and takes 3 to 4 days before it can exert therapeutic anticoagulation. The heparin will provide therapeutic anticoagulation until the therapeutic effect of warfarin is achieved. Nurses need to be careful when checking the dose of anticoagulants to be administered, and often it is facility policy to double check with another nurse before administering. Monitor the patient for signs and symptoms of bleeding, including hematuria, frank or occult blood in the stool, ecchymosis, petechiae, altered mental status, or pain, which could indicate abdominal bleeding. Monitor vital signs frequently for decreased blood pressure and increased pulse. Have antidotes available as needed. Protamine sulfate for heparin and vitamin K for warfarin. Monitor activated partial thromboblastin time, or APTT, for patients receiving unfractionated heparin. Monitor prothrombin time, or PT, and or international normalized ratio INR for patients receiving warfarin or low molecular weight heparin. Apply prolonged pressure over venipuncture sites and injection sites. When administering subcutaneous heparin, apply pressure over the site and do not massage. Teach the patient going home while taking an anticoagulant to use only an electric razor. Take precautions to avoid injury. For example, they shouldn't be playing around with hammers and saws. They also should report signs and symptoms of any bleeding, such as bleeding in the urine or stool, nosebleeds, ecchymosis, or altered level of consciousness. Also teach them to take the prescribed dose of the drug at the precise time that it was prescribed to be taken. And finally, they shouldn't stop the drug abruptly. The physician usually will taper the dose of anticoagulation gradually. Antiplatelets are used to prevent thrombus in the arteries by suppressing platelet aggregation. Heparin and warfarin prevent thrombus in the veins. Antiplatelet drug therapy is mainly for prophylactic use in prevention of heart attacks and strokes. Long-term, low-dose aspirin therapy has been found to be both an effective and inexpensive treatment for suppressing platelet aggregation. For patients with history of stroke or myocardial infarction in the family, the recommended aspirin dose is either 81, 162, or 325 milligrams per day. Trental has been approved by the Food Drug Administration for patients with intermittent caudation and has been prescribed for those with Buerger's disease.